Hi, Dr. Tammy Penhollow with Precision Regenerative Medicine in Scottsdale, Arizona. We're going to talk about the knee and how many patients I see on an average week for knee pain. Most often it's something such as arthritis, and there are 4 different grades of arthritis from 1 to 4, 1 being mild, 4 being severe. Oftentimes people with a grade 4 knee osteoarthritis have been told that they are bone on bone, and they literally have no supporting cartilage and no cushioning of that joint. And it may be more on one side, typically on the inside, or it can be outside, or there's actually 3 compartments. It can be all 3 different compartments. Those patients are often offered a total knee replacement, or TKA, total knee arthroplasty, and they often don't want to have that. So they'll come to me, and depending on what stage they're in, grade 1 to grade 4, depends on how we treat it. We can start with PRP in some instances. We can step it up a notch to move to A2M or alpha-2 macroglobulin to hopefully halt the progression of the OA, particularly in a younger person or after a trauma. It can maybe be addressing the traumatic arthritis and halt it in its phases, or we may need to use bone marrow aspirate concentrate. The second most common reason that I'm seeing patients for knee pain is typically a tear, and that can be in the ligaments or in the meniscus, but really by far the medial meniscus seems to be one of the most frequently injured meniscus or soft tissue structures of the knee. And traditionally, patients would have medial meniscectomies or arthroscopies to shave the meniscus, the torn parts. But here's the deal. Over the last few years, it's not just recent, but over the last few years, the orthopedic surgery community has found that those patients who undergo surgical repair of the medial meniscus when it's not a complete tear, even partial meniscectomies or just arthroscopies to shave, those patients are rapidly progressing to higher degree osteoarthritis and rapidly progressing to total knee arthroplasty at a much younger age than if they'd left it alone. Or if they hadn't left it alone, then what we can do is we can use an orthobiologic in the area. And yes, I actually do put either PRP, A2M, or bone marrow aspirate concentrate, depending on each patient, the level of pain, the level of arthritis, the level of the tear. And we talk about that at the consultation. It is the imaging and MRI, along with the physical exam, the history, and an ultrasound guided exam of the knee, with me performing that right there in the office so that we can see. I mean, an MRI is a static image. The ultrasound is dynamic. It's live. I can sometimes see whether or not there are complete tears or incomplete tears based on placing the ultrasound appropriately and knowing what to look for. So the knee is a very, very common source of referral for me. And when people have knee pain, it affects their ability to walk, their ability to run, certainly their ability to play sports or do regular activities. Think how often you walk. It's involved in just about everything you do. So relieving knee pain, improving quality of life, those are big reasons that people seek us out. And we do address it non-surgically with ultrasound guided injections of your body's own PRP, A2M, or bone marrow aspirate concentrate. If you'd like to hear more, please reach out at precisionmedprp.com. Again, Dr. Tammy Penhollow with Precision Regenerative Medicine in Scottsdale, Arizona.